deadly Legionnaires disease outbreak in Harlem is continuing to cause concern. At this point, more than 70 people have been sickened and 3 people have died from this serious lung infection since late last month. City officials treated nearly a dozen cooling towers in 5 uptown zip codes after they tested positive for waterborne bacteria that causes the disease. Health officials are urging residents, especially those with underlying conditions, to take extra precautions. Joining me now to talk more about Legionnaires is the Executive Vice Chair of Medicine at Maimonides Medical Center, Dr. Edward Chapnick. First of all, thank you for coming on the Rush Hour. I want to start with what the city is telling people: take extra precautions if you have underlying conditions. What kind of precautions can people take, and what underlying conditions are we talking about?
Okay, well, first of all, thank you for inviting me. And the underlying conditions that put people at highest risk for getting severe disease from Legionella include advanced age, which isn't really an underlying condition, but from the age of 50, the risk sort of progressively increases. Also, people who are smokers, who have underlying lung disease, or have any condition that suppresses the immune system. One of the more common ones is diabetes. Now, taking precautions really means trying to avoid aerosolized water. That's how Legionella is spread. And in the area that this outbreak is occurring, that could mean things like taking a bath instead of a shower, or not being near anything like a humidifier or anything that could put water vapor into the air.
So talk about the disease. It sounds like it obviously spreads through vaporized water, as you say. Talk about, for people who don't know what Legionnaires is, what is the disease and how does it attack the lungs?
Well, the first thing is most people think of pneumonia as one disease, and it really isn't. Pneumonia just means an infection in the lungs, and it can be caused by many different things, including viruses like the flu or COVID, and certainly bacteria like Legionella, which is the thing that causes Legionnaire's disease. And it's important to know that this is probably a very common infection. Most people who get it, though, that is, people who don't have the risk factors that I mentioned before, would get a very mild disease and just think they had a cold or a mild case of bronchitis and probably wouldn't even seek medical attention. In people who have the conditions that predispose to worse disease, the bacteria enters the lungs just by inhaling it. And when the immune system can't adequately fight it off, or when there are problems caused by smoking and the lungs' ability to expel bacteria, that's when people can get very sick.
Mm-hmm. And what is the point that you should know that you should be seeking medical attention, that it is more potentially than just a cough or a bad cold?
Well, certainly a person wouldn't know at the time they got sick what the cause is, but it's a good idea to see a physician if you develop respiratory symptoms, that is, cough, shortness of breath, pain in the chest that's worse with coughing, and accompanied by fever. And especially people who are older and or have a compromised immune system should certainly seek medical attention at that point. The good part of all of this is Legionella, if caught early, responds very well to standard antibiotics.
And that led me to my next question: how treatable is it? When you hear that there are these clusters of buildings, though the city doesn't want to identify specifically what buildings there are in, what are you advising patients who live in that general area? Is that simply to take a bath instead of a shower, avoid humidifiers and any type of vaporized water, as you had said?
Exactly, and there are New York City rules about treating cooling towers. And for those who aren't familiar with cooling towers, it's just basically a device that evaporates water, usually from an air conditioning system, and then takes the water back into the system. So these cooling towers certainly are meant to evaporate water. So if Legionella is present in that water supply, it's unfortunately a very good way to spread the infection. When the health department identifies Legionella in the water supply of a building, they immediately require steps to get rid of that Legionella, which can involve chlorination, it can involve heating the water. There are various ways Legionella can be treated in the water system.
Executive Vice Chair of Medicine at Maimonides Medical Center, Dr. Edward Chapnick, thank you so much.
Thank you for inviting me.